Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
How did you feel about the cleaning procedure with Mrs. Thompson?
I felt it went smoothly, but I did struggle a bit with the ultrasonic scaler around her lower molars. I'm still trying to get the hang of it with tighter spaces.
I noticed that. Remember, in tighter spaces, angling the tip more towards the tooth surface can help. Did you feel you addressed her gum bleeding adequately?
I did explain that her gums were inflamed, but maybe I could have emphasized more on the importance of flossing daily.
Exactly. Patients often need reminders about the long-term benefits of daily flossing, especially when they experience gum bleeding. It's a teachable moment, so always capitalize on it.
Now look at question 26.
We have 15 MRIs and 10 CT scans scheduled for today, and we're short-staffed with only 3 technicians.
Right? Let's prioritize the MRIs for patients needing surgical planning first. They'll need their results quickly. We can slot the CTs around them, especially since they're faster.
That sounds like a plan. I'll handle the MRIs for the surgical patients. Can you manage the CTs and other MRIs?
Absolutely. Also, let's make sure we coordinate with the nurses for any patients needing contrast. We'll need to ensure they have their blood tests done before the scan.
Great point. I'll inform the nursing team right away. Let's make this work.
Now look at question 27.
Hello, I'm Jane, and I've just had my first baby. I've been getting so many different pieces of advice about feeding, and I'm honestly a bit overwhelmed.
Congratulations on your new baby, Jane. I understand how confusing it can be with so much information out there. I'm here to provide evidence-based recommendations and help you navigate this journey. Tell me, have you decided on breast milk, formula, or a combination of both?
I've been trying to breastfeed, but I'm not sure if my baby is getting enough. Some friends suggested I supplement with formula just to be sure.
It's a common concern for many new mothers. The best way to determine if your baby is getting enough is to monitor their weight gain and diaper output. If your baby is gaining weight and has regular wet and dirty diapers, they're likely getting enough. However, if you choose to supplement, or if there are any concerns, it's essential to do so safely and in consultation with a pediatrician.
That's reassuring to hear. I'll keep an eye on those signs. Thank you for your guidance.
Now look at question 28.
Good morning. I'm John, the physical therapist assigned to assist with your post-surgical rehabilitation. How's your knee feeling today?
Morning, John. It's a bit sore and stiff, especially in the mornings. I'm quite worried about the pain during our sessions.
It's normal to feel some discomfort, especially after a surgery. Our goal here is to gradually improve your knee's mobility and strength without causing undue pain. We'll always adjust our exercises based on your comfort level. Remember, communication is key.
I appreciate that. I've heard that consistent physical therapy can really make a difference in recovery. I'm committed to the process.
Absolutely. With dedication and consistent sessions, you'll be back to your regular activities in no time. We'll work together to ensure the best possible outcome for your knee.
Now look at question 29.
I was reviewing Mrs. Smith's chart and noticed she's on IV fluids. I'm still getting the hang of fluid management. Can you help me understand the rationale behind her current regimen?
Of course. So Mrs. Smith is on a maintenance IV fluid because she's currently nil by mouth due to her upcoming procedure. Are you familiar with the 4-2-1 rule for fluid calculations?
I've heard of it, but haven't used it practically.
No worries. It's a method to calculate the hourly maintenance fluid requirement. 4 millikilograms for the first 10 kilograms of body weight, then 2 millikilograms for the next 10 kilograms, and finally 1 millikilograms for the remaining weight. We use this as a baseline and adjust based on the patient's clinical status and lab results.
Got it. I'll make sure to apply this rule when reviewing her fluid status. Thanks for the guidance.
Now look at question 30.
Hi there. I've been feeling quite fatigued lately and read online that certain supplements might help. What would you recommend?
Hello. There are indeed several dietary supplements that people take for fatigue, but it's essential to first rule out any medical conditions. Have you seen a doctor about your fatigue?
Not yet, but I wanted to see if there's something over the counter I can take in the meantime.
I'd always recommend seeing a doctor first, but in the meantime, some people find that B vitamins, magnesium, and iron can help with fatigue. However, it's crucial not to take excessive amounts as they can have side effects. It would be best to ensure you're getting the right dosage and that they won't interact with any other medications you might be on.
Thank you for the advice. I'll consult with my doctor and then decide on the supplements.